Hello everyone, my name is Nikki.
Hello everyone, my name is Maryam.
And today we are here to present our paper titled Quality of Life Measures in Pediatric Multiple Sclerosis, a systematic review and meta-analysis. So what is this study about? This study is a review of measures used to measure quality of life and health-related quality of life in children and adolescents with MS. And why was this done? So MS is actually a very rare disease in children and adolescents. And with regards to treatment options, evidence on effectiveness and on a growing brain is actually very limited. So there's actually a lack of information on the impact of MS in the lives of children. And one way of quantifying impact is to measure quality of life or health-related quality of life of children with MS. So the objectives of this study is threefold. One is to identify the generic quality of life and health-related quality of life measures used in pediatric MS. Two is to estimate an overall score. And then three is to actually compare these scores with the scores of typically developing children.
So how was this study done? We did a systematic search of 4 databases: Medline, CNOW, MBase, and PsycInfo. And our inclusion criteria for the eligible articles were if the articles had the sample of children with pediatric multiple sclerosis, and if self-reported quality of life or health-related quality of life scores were reported within the papers, and if the sample, mean age of the sample were below 21 years old. So how did we do this study? For the risk of bias, we used 2 checklists. We used the strengthening the reporting of observational studies and epidemiology, the STROBE checklist, in order to see the quality of the reporting of the papers. And we also used the mixed method appraisal tool for appraising the quality of the research done. Mean values of the total scores and summary scale scores were pooled, and we used GEE with maximum likelihood estimation. As seen here on this slide, most of the studies had been done either in Europe or in the States or Canada. We had 12 articles which met the inclusion criteria and were included in this systematic review, 7 of which had been included in the meta-analysis, which these 7 papers had used the PEDS-QOL measure. Pediatric quality of life measure was the most common tool. 10 out of the 12 papers included in this review had used PEDS-QOL, and most of the studies were cross-sectional studies. There was high to moderate risk of bias also noted when we did appraise the quality of the papers. And most of these risk of biases were related to a selection bias, given the nature of the studies, which had been mostly cross-sectional. And therefore, we did not exclude any of the papers from doing a systematic review and meta-analysis.
So if we look at the measures used, so we have 3 different measures, but mainly obviously the PEDS-QOL was the most common one. And if we compare it to the quality of life domains by Flanagan, you can see that all the measures do not measure all domains of quality of life. And then with regards to scores, so the estimated scores on the Pediatric Quality of Life Inventory was actually pulled, and the pooled estimate was 75.7 with a pooled SD of 17.3, and this is out of a score of 100. And so when we compare it to a sample of typically developing children, and this is from a previous systematic review of the PEDS-QOL on typically developing children, you can see that in terms of total skill scores, physical scores, psychosocial, they are pretty much quite the same, quite comparable. But in terms of school and emotional skill, in pediatric MS, it's actually slightly lower.
So that leads us to the conclusion of our systematic review. What does it mean actually? We saw that very few studies were looking at quality of life in children in general, because there are a very scarce number of studies done on multiple sclerosis and quality of life in children. The quality of the studies, as mentioned before, was really low, and health-related quality of measure was used to measure quality of life. However, it's really important to notice that these 2 concepts are distinct in terms of their definition, and health-related quality of life measures do not capture all the domains of quality of life.
So in addition, some of the scores that we saw on the PED score with MS were actually comparable to that of typically developing children. And so this actually raises the question whether items on generic measure, like the pediatric quality of life, actually reflect the domains that are actually relevant to children and adolescents with MS. And so this really reiterates the need of whether a disease-specific measure is probably needed for children and adolescents with MS. So thank you very much for listening to us, and we would like to acknowledge the Montreal Children's Hospital Foundation and thank them for funding this study.
And also we do want to extend our acknowledgement to the Journal of Developmental Medicine and Child Neurology for this opportunity to present our systematic review.
Thank you very much.